It's been covered throughout the media.
Oh, no, cancer is ending my life. I am choosing to end it a little sooner.
And the controversial topic is gaining attention.
I'm not ashamed to attach my name to what I think is a right that should belong to all terminally ill Americans.
After being diagnosed with terminal brain cancer, 29-year-old Brittany Maynard moved to Oregon. Along with Washington, Vermont, Montana, and New Mexico, these states legally allow physician aid in dying.
And it's not euthanasia, because euthanasia is direct physician killing of the patient.
Instead, a physician instructs and provides a patient with a deadly drug, usually an oral pill, to take on their own after being declared mentally competent.
The patient then has much more control over precisely when the dying will happen.
Since the law has been enacted in Oregon, about 1 in 3 patients do not go through with taking the deadly drug.
In part because most often these are patients who in fact are getting hospice care.
Dr. Leonard Fleck is a Michigan State University philosophy professor and medical ethicist. For the number of patients actually committing physician-assisted suicide, being able to control death is controversial.
It's the individual alone who has what we might call the moral and legal right to exercise that choice.
And Fleck thinks that choice should be provided to everyone.
I believe that the practice ought to be legalized in all 50 states. I do not see any intrinsic moral objections to the practice.
But he recognizes where critics stand.
The argument against it is essentially that human beings should have no control over life and death.
Second-year medical student Dexter Clark is one of these critics.
Just from a moral standpoint, I don't think it's a good idea to end someone's life prematurely.
But even with the controversy, Dr. Fleck thinks there will be a growing support of the option in the future.
My guess would be that over maybe the next 20 years, it will probably be legalized in virtually all of the states.
For Dr. Lindemann, she believes this comes down to our society.
We don't like to think about death. We don't like to talk about it. We hide it away in nursing homes and ICUs. We are afraid of it. And so in a society like that, people want control.
And that control to choose when your time ends has yet to be decided entirely. For Focal Point, I'm Carmen Scruggs.